Today we're going to be videoing the procedure of doing capillary blood glucose testing. And we're going to do this test in a home healthcare setting, which is inside the home. So it may vary a little different from when you do it in the hospital, but the concepts basically are the same. So let's talk about first the supplies that you would need to do a capillary blood glucose. First of all, you'd need a glucometer. Second thing you need is some alcohol preps. You'd need some type of lancet device. And we're going to go ahead and use these one-time lancets. You need some gloves. You need some kind of tissue or gauze to be able to use once you stick the client. And then you need some form of sharps container. And since we didn't have a sharps container, we improvised and we're going to use this, which will serve the purpose. So in using any type of glucometer, and there's several on the market, we'll be using the One Touch Ultra today. As a nurse in the school setting, in the home care setting, or in the hospital, you should always know what are the steps to use it and has it been tested and is it working right, which is a form of quality assurance. So since this is the home setting, when you go to visit a client, you want to make sure that you have the procedure manual for the One Touch Ultra, because every glucometer has different ways in which you test it to make sure that it's working right and different ways in which it works. So since this is a new vial that we will be using of test strips, we're going to go ahead and do a control testing of it. Let me move these supplies out of so you can see how we do it. So prior to doing this, I read the manual on how to do it. And of course, the patient could also do the control testing because they should be doing it. Most of the time, the manufacturer will recommend that a control testing, which is a form of quality assurance, be done when you have a new vial, a new set of vials. If the patient or the client were to have dropped the meter, or let's say if they test in their blood sugar and it's reading 400, but they feel like they're 60, and so the meter's not correlating to the client's symptoms, then you would always want to do a control test. So we're going to take a strip, and we have to have control solution, and most control solutions are required that you shake them so that you can mix up the solution. And the majority of control solutions also, they're only good for 3 months. So it's a good idea that you train the client that once they use it, that they need to put a date on it, that it's only good for 3 months. So go ahead and open that up. I'm going to insert my strip. And like I said, every meter is different. For this meter, you actually have to mark that it's going to be a control test. So also with this meter, I'm going to make sure that my code on the meter matches my code on the strips. Let me do that again so you can see it. Let me do it slower. So I insert the strip, and then the meter's going to read 25, and you see my strips read 25. And then what I'm going to do is I want to make sure that it understands that this is control solution and not the actual patient reading, because his readings are going to be logged in to be shown to the doctor later on. So I'm going to press the up arrow, and it's going to say apply control solution. And I went ahead and I shook the vial, and I'm going to apply the drop. And then what I'm going to do with this reading, so this is 139. So according to my vial, it says that control range would be 123 to 167. So I am within the range. And what I want to do is document this on a control log. And I should be doing this at, every time we open up a vial, like I said, or every time we think the machine isn't working or there's a possibility that it could be broken. So we'll go ahead and put this off to the side. So now we know that this meter is working properly. So we'll take this control solution and save it out of the way. And I already put the date for 3 months. So I put that it's going to expire on 11/29/2016. So this is our willing participant. Why don't you go ahead and tell him your name?
Anthony Ashley.
And Mr. Ashley, do you give me permission to test your blood glucose?
I do.
And you give me permission to video you and put this on YouTube?
Yes.
Okay. So Mr. Ashley, what we're going to do is I'm going to show you how to check your blood glucose. What you want to do is, this is a procedure that involves body fluids, so you always want to follow universal precautions. Another thing too is that anytime before you touch the client, you want to wash your hands. And because we're actually sticking his fingers, we had the client wash his hands. So just know that I did wash my hands prior to this test, and he washed his hands. And I am going to put gloves on since I know that, I will be exposed to blood. Okay, finding the proper place to stick. So let's start with which fingers you'd use first. First of all, are you right-handed or left-handed?
Left-handed.
Okay, so he is left-handed. So we're actually going to want to stick the hand that is the non-dominant hand, which is his right. You want to turn more towards me so you can feel more comfortable? Okay. All right, so what we're going to do is most studies recommend that you don't use the thumb and you don't use the index finger. And so the two most common fingers that you're going to use are these two in the middle. Now the side of the stick, you don't want to do the fingertip and you don't want to do the middle of the fat pad. You want to do on the sides of the fat pad, of the middle pad. I'm going to put my gloves on. And you have no allergies, correct?
None.
Okay. So I'm going to take this middle finger, and if Mr. Ashley were a diabetic, we would be asking him to rotate his sides because you don't want him to continue to stick the same finger over and over. And for today's sake, I'm going to use a one-time lancet. And so you also should know the gauge of your lancets. This is a 23. So just realize that the gauge is the diameter of the needle. So the smaller you go, the bigger that the gauge will get, and it can become painful. So you really want to go with the gauge that is the largest, which is actually the smaller diameter, that you need to draw a good drop of blood. So I'm going to alcohol wipe it, and I'm going to give it a couple of seconds to dry while I put the strip in and get the meter turned on. For this lancet, you just twist the top off. And remember earlier I made sure that the code on the meter matched the code of strips. So where I'm going to stick, and can you zoom in so we can show, I'm going to come here off, not too far to the side, but somewhere in between the side and the middle of the fat pad. I'm going to press it close to the skin. And let's see if I got a drop. Now, getting the drop. You don't want to squeeze too hard, because squeezing too hard can actually change the results. It can alter it. I'm going to milk up okay, there we go. Now that's not as clean as I would have liked it. It's better when you can get a drop of it, but it still was adequate. So Mr. Ashley has a blood sugar of 120. Did you just eat something?
Yes, I ate a ham sandwich.
Okay, good. So you see, he just ate some carbs. So we know that normally blood sugar would be 70 to 110. But while we're on the subject of capillary blood glucose, we're going to also talk about hypoglycemia, which is something that can happen in your type 1 diabetics and needs to be treated quickly. But getting back to let's finish the capillary blood glucose. So I'm going to apply some pressure to where I start, make sure it stops bleeding. And then I'm going to want to document the 120. I'm going to take my strip out and throw it. And then I'm going to take my lancet and put it in a sharps box. And you see what I could do is all this extra stuff, the OH test strip and the alcohol wipe, I'm going to take it in my gloves and make me a little cover up for all that. Okay, so that concludes the procedure of the capillary blood glucose testing. Okay, so now we're going to talk about treatment of hypoglycemia. Hypoglycemia, and usually what will happen is that it's usually considered a blood sugar of 70 or below. But when you're, no matter what client you're serving, whether it be in the school setting, the home health setting, or the acute care setting, the doctor is going to give you parameters. So you'll have parameters to know when to do what and what you need to do. But there's something that you need to teach your clients, and also like in the school setting when we delegate to non-licensed personnel, we have to teach them how to do an injection which is called glucagon. And so you have to be very familiar with the glucagon because you have to know how to give it, but then you also have to teach, a lot of times you'll have to teach family members because they're going to be the one that has to give it to the client. And then you also, in the school setting, would have to teach the non-licensed personnel. So what supplies do you need to administer the glucagon? First you need the glucagon kit. You need some alcohol pads, and then you need some gloves, and a sharps box. Now I'm going to have these injection pads because we're not going to actually stick a client. And what I did here is what I do is when I have diabetic clients, these glucagon pens, they're glucagon injections, they're not stable after 3 hours. So it's, let me open it up to show you. It's actually an injection of, some saline in the glucagon is the powder. So once you mix it, once you reconstitute it, then it's going to only be good for 3 hours. So that's why the client has to know how to mix it right when they need it. So what we do is these are only good usually for they expire within a year. So what I tell the clients is when they expire, just give them to me. And then this is what I use to have the clients, family members, or the non-licensed personnel, we train them in how to use it. And it's really nice when they get to use an actual glucagon. And then what we do is we use the injection pads. Now everyone makes glucagon in their body, so this is you're actually giving them an injection of it, which is going to cause the breakdown of glycogen into glucose, and glycogen is stored sugar in the liver. So the first thing is the client is unconscious, and usually there's 3 parameters that the doctor gives you: unconscious, or seizing, which they're unconscious if they're seizing, more than likely, and or the inability to swallow. And I've seen this before where clients, they drop so low that the ability to think, it goes out the window, and they're so confused and disoriented, they're agitated, they can't even remember how to swallow. So I've actually had to give a glucagon when the client was still, they weren't unconscious and they weren't seizing, but the client kept telling me, I can't swallow, and his blood sugar was dropping, so I had to give it. But let's go ahead and get back into the procedure of actually giving the glucagon. So because it's an injection, you're going to want to wear your gloves to protect you and the client. But I don't have to put them on now because I'm not giving the injection yet. So I'm going to go ahead and open up my kit. Okay, so the glucagon, and this is 1 milligram, and it's a universal kit. I've never seen it any different. So once I reconstitute it, it's going to be 1 milligram, and it's actually it's in 1 cc. I'm going to flip the gray top off. I'm going to uncap the needle. I'm going to inject the saline into the powder. I'm going to make sure that when I take the needle out that I don't contaminate it. And I'm going to gently swirl, because if you swirl too hard, what happens is, and it already did make a bunch of foam, but it'll be even worse. And the thing about the foam is it just makes it harder for you to draw up the whole amount. Okay, so it's all mixed up because I can tell that my powder is all dissolved. So I'm going to turn the vial upside down. I'm going to find my bevel, because what I'm going to do is keep the bevel of the needle as low as I can get it so that I don't draw up air. Okay, then I'm going to draw up the whole cc. And remember, you're teaching non-licensed people in the school setting to do this, which are secretaries and teachers' aides, depending on your school and your state and the policy of what it is. And then you're also teaching the parents of the clients, the wife of the client, or the friend. You're teaching lay people. Alright, so now I have my 1 milligram of glucagon ready to go. Remember, it has to be given in 3 hours. So the site of where to give it. So you could give it in any major muscle. So I usually always teach the deltoid, because especially if I'm in the home health setting or in the school setting, if someone has pants on, then it's harder to take the pants off than it is to roll up the sleeve. So you teach the person to put the gloves on, especially if you're in the school setting. Now in the home health setting, you wouldn't, you don't have, I don't think that you would teach the parent to put gloves on. Alright, so I'm going to alcohol wipe my area. And then depending on the amount of fat tissue and muscle mass, it's going to be whether you're going to go in at a 45 or a 90-degree angle. The deltoid is it's not a big muscle, usually. But I'm going to go in at a 90-degree angle for this one. So what I want to do is stabilize my area. I take my thumb and my finger next to it, and I'm going to do a dart-like action.
Now I'm not going to actually press the solution in there because it would mess up my model that I have to use. But what you actually do is you press the syringe in and you push in all the fluid. Then you wait 5 seconds. So you would press the plunger down, wait 5 seconds, and then pull the needle out. And then wipe it off again. Now of course you don't recap a needle. You're going to take the needle and the syringe and you're going to throw it in your sharps box. I'm not going to throw this one because we reuse this to teach over and over. So some things that you need to know about glucagon is that this is not going to work right away. Is that it's going to take 15 to 20 minutes more than likely before the patient becomes conscious again. So obviously anybody who's unconscious, seizing, or is too confused and the blood sugar is too low that they can't even swallow, 911 should have been called. And if they're unconscious or seizing, you're going to want to turn them to the side because this does cause nausea and projectile vomiting, and so the last thing you want them doing is vomiting when they're laying flat on their back, and then they would aspirate. So this concludes the procedure of glucagon, and I hope this helps. Remember too, you take your gloves off and discard them into the trash can and wash your hands.